To all who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Relevate Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website or register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Relevate Sports Medicine, supporters of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare professional or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. The email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the email or you have any other concerns, then contact us via our email at journalclub@relevatesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Dr. Christina Cherian is board-certified family medicine physician with a passion for empowering patients through evidence-based nutrition. She completed her undergraduate degree at University of South Florida in Tampa, where she majored in biomedical sciences and minored in public health. She remained at the University of South Florida, Morsani College of Medicine, for her medical degree through the Honors Medical Program. She completed her residency in family medicine at the St. Vincent's Family Medicine Center in Jacksonville, Florida, and was awarded the Jane Lanier Community Service Award upon graduation. She is educated in prevention and reversal of chronic diseases such as high blood pressure, diabetes, and high cholesterol through the tenets of lifestyle medicine, especially plant-based nutrition. She holds a certificate in plant-based nutrition via the eCornell Center for Nutrition Studies and a board certification in lifestyle medicine. She currently offers one-on-one care through Lotus Lifestyle Medicine, an exclusively telemedicine practice dedicated to helping reverse disease through the 6 pillars of lifestyle medicine. I'm going to mute myself and then see. Okay, and what's going to happen next is you're going to get a pop-up on your screen. Oh, thank you, Nadine. Well, yeah. Okay. Oh, there we go.
Do I have to quit and reopen this in order for it to be able to record content?
No. Do you have a did you have a window pop up that says show my screen? Okay.
No, I had one about recording.
Oh, okay. Let me do.
I think it'll be fine. It's going to be record. Will it be able to?
Showing my screen.
I can quickly. What it's telling me is I can. It says that coaching won't be able to. Oh, okay. Let me see here.
Okay, now it's back to waiting to view.
Let's see. Let's try this. Is that working?
That looks perfect.
Okay. All right.
I'll have you take it away.
Perfect. Sounds good. Thank you so much for having me. So like Dr. Henny said, my name is Dr. Cherian, and I am super passionate about lifestyle medicine and especially plant-based nutrition. One of the reasons why I stayed in medical school is because I discovered that it was just so powerful, and I figured maybe I should finish medical school and promote this in my patients. So during this presentation, I will dive into diet and its relationship with chronic disease, but I'll also make recommendations for this way of eating that has been shown to help to treat and even reverse some chronic diseases. I will focus on protein requirements as well. So I have nothing to disclose. As far as learning objectives, identifying the role of diet in the development of this chronic disease, and explaining key nutritional components of the diet, so macronutrients and such, as well as whole plant food groups and how they contribute to prevention and management of chronic diseases. And as I mentioned, we will be going over daily protein requirements for the average adult human and also the average athlete. And we'll go over plant-based protein sources to meet those daily requirements. So the biggest predictor of how we will die is what we eat, which is why I'm so passionate about this. And as we know, this factor is entirely in our control. And as athletic trainers, one of your responsibilities is also to promote wellness in athletes. And so that's so that they can perform their best, but also so that you can feel your best, so they can feel their best and also live long after their athletic career is over. It also helps in the recovery of injuries as well. So the #1 cause of death in the United States is actually the American diet. And in fact, genetics only actually accounts for about 10 to 20% of the risk when it comes to chronic disease. So what that means is that even if you were dealt a poor hand with a family history of diabetes or high blood pressure or stroke, you actually have much more of a say in your health than you might think. So these are the top killers in the US, and the ones that I'm highlighting here are directly associated with diet. And today we are touching on heart disease, cancer, and diabetes. So heart disease is the leading cause of death in the US and the world, as many people know. And it is also, of course, the leading cause of death in former athletes, just as it is in the general population. And one person dies every 37 seconds in the US from cardiovascular disease. Cancer is the second leading cause of death, as we saw in that chart. And the 4 most common cancers are lung cancer, colorectal cancer, breast, and prostate cancer. And all of these are affected by diet and lifestyle. And then diabetes. 1 in 10 in the US have diabetes. Over 1 in 3 have prediabetes. And one scary statistic is that 1 in 4 US adults who have diabetes don't even know that they have it. It's the 7th leading cause of death in the US, a major risk factor for our #1 killer, heart disease, and it is the leading cause of kidney failure, lower limb amputations, and adult blindness. So the rates of all of these are unfortunately on the rise, and these slides show how the prevalence of diabetes has increased over the past 2 decades. So what has changed over the last 2 decades? Well, it's not genetics, right? It's diet. So here we have the standard American diet. We also call it the SAD diet, but this is the way of eating that is responsible for this rise in obesity and chronic disease over time. And unfortunately, over 60% of this way of eating is processed food. And the majority of that 6% of the processed plant food is actually just fries and ketchup, which we can all agree is not a health food. Only 6% is whole plant food, which is fruits, vegetables, whole grains, legumes that has not been modified as much as possible from when it originated out of the ground, right? So the standard American diet is high in processed foods, animal products, including meat, chicken, seafood, eggs, and dairy, and also sugar. And this way of eating is strongly linked to increased risk of developing high blood pressure, diabetes, heart disease, and several cancers, especially breast, prostate, and colon cancers. So what's the solution to our SAD diet? It's what's called the whole food plant-based diet. This means eating predominantly plant-based unprocessed foods. So those main food groups are whole grains, legumes, vegetables, fruits, nuts, seeds, and herbs and spices, as shown in this pyramid here. And this way of eating discourages animal products, including chicken, including fish, and dairy and eggs as well. I'll dive more into this in the second half of the presentation. So plant-based diet can help to manage all of these medical conditions and more. There is a lot of evidence that it can positively affect all of these. So we'll start with heart disease. This is not a comprehensive review of all of the evidence, but it's just a few studies that show the impact that diet can have on these chronic diseases. So this study was a randomized control trial done by Dr. Caldwell Esselstyn at the Cleveland Clinic, and it involved 198 patients with cardiovascular disease who were counseled on a plant-based diet. And 89% of them were adherent to the diet, and there was only one stroke in that group compared to 13 out of 21 non-adherent participants who 13 of them experienced adverse events. There's also, actually, here's the diagram from this study showing the reversal of stenosis in the left anterior descending artery on the diagram on the right there. And this was following 32 months of a plant-based diet without any medication. There was also a study that I didn't get to put I didn't put it on this presentation, but there's a lifestyle heart study by Dr. Dean Ornish that was published in Lancet and JAMA, and it was a randomized control trial as well, and it showed that the control group that did not follow a whole food plant-based diet had worsening of the stenosis, so the narrowing of the arteries in the heart, and the group that followed a whole food plant-based diet showed improvement in stenosis. And these changes actually are not related to the age or disease severity, but the adherence to those recommended changes. So what that means is that the more fruits, vegetables, whole grains, and legumes that you consume, the fewer of those animal products, you'll see that much incremental improvement. All right. And then with diet and diabetes, there's this huge misconception that sugar causes diabetes and that fruits are bad for people with diabetes, but that is not true. So diabetes actually comes from fat buildup inside of our cells, and that prevents insulin from moving sugar out of our blood and into our cells. And this is called insulin resistance. And this fat buildup in the American diet comes mostly from cheese and also meat. Those are the biggest sources in the American diet. There are several randomized control trials showing that plant-based diets are more effective compared to other diets in glucose control in patients who have diabetes. And so one of these was conducted by Dr. Neil Barnard and colleagues, and they compared a low-fat vegan diet to the guidelines set by the American Diabetes Association. And at 22 weeks, the study showed that both of them improved glycemic control, but the plant-based group had better results, and this was actually comparable to that of diabetes medications. And when it comes to diet and cancer, we know that when we grill, char, or smoke meat, it actually produces cancer-causing compounds. And so women who eat these cooked meats, these meats that are cooked in this way, may have as much as 47% higher odds of breast cancer. And we also know that processed meats are linked to colon cancer. So this means bacon, hot dog, pepperoni, processed lunch meats. These are class 1 carcinogens. And just like tobacco, alcohol, asbestos, and formaldehyde, these foods directly cause cancer. And then studies also show that high levels of cholesterol appear to stimulate breast cancer, the growth of breast cancer cells as well. And eggs as well, there's a significant increase in breast cancer risk once women get to around 5 eggs a week or more. And then when it comes to dairy, there have been studies showing an association with dairy intake and increased risk of breast and prostate cancers. Most of our dietary exposure to hormones actually comes from dairy products. And up to 20% of cancers are linked to infection, and studies suggest a link between bovine leukemia virus exposure in cow's milk and other dairy products and human breast carcinoma. Also, when it comes to breast cancer, high intakes of red meats, animal fats, and refined carbohydrates, so those white breads, sugars, sugary foods, have been shown to be associated with an increased risk. And then intake of those whole plant foods and dietary fiber has been associated with a reduced risk of breast cancer. We also know that there is no safe amount of alcohol use, so limiting alcohol, eating mostly plant foods, and maintaining a normal body weight was also associated with a 62% lower breast cancer risk in women. When it comes to diet versus medications, diet addresses the root cause of the chronic disease, and medications do not. And they simply don't work as well as diet does for this reason. And on top of that, we know that meds may have unpleasant side effects and long-term issues. So everyone knows about Ozempic by now, and in some cases it can cause pancreatitis. And there are other issues with other medications. So it's better if we just treat these conditions by treating the cause, which is diet. Now, when it comes to a whole food plant-based diet, I like to focus on the actual food groups rather than talking about the macronutrients, which are protein, carbohydrates, fat, etc. But today I'd like to break these down because most people have certain foods in mind when they think about each of these. So it's good to understand kind of how those play into a whole food plant-based diet. So protein, when people think of protein, they think of meat. Well, all protein actually originally came from plants, right? So the original source of all protein is plants, and all vegetables, grains, nuts, and seeds contain protein. The recommended daily protein intake for the average adult is 0.8 grams per kilogram of body weight. And we'll talk about that for athletes in just a second. Now, there is a myth about about plant-based protein, and that it's inferior because it's not what's called a complete protein. And a complete protein contains all 9 essential amino acids. But if you eat a whole food plant-based diet, you actually get all of the amino acids that you need to meet over the course of a meal or over the course of the day. So it doesn't have to be found just in one particular food. And studies show that the average vegetarian or vegan actually meets or exceeds that recommended daily protein intake. Studies have also shown that replacing animal protein with a plant protein results in a reduced risk of diabetes. So this sample menu shows that it's pretty easy to get the target protein intake on a plant-based diet. If you have, say, breakfast with 1 cup of oatmeal and a cup of soy milk, and then lunch with a split pea soup, whole grain bread and hummus and a salad. And if you snack on apple and peanut butter, and then dinner with, say, Mexican black beans with brown rice, on tortillas with avocado and salsa. And this is without adding any kind of protein powder. When it comes to whole food plant-based sources of protein, seitan, which is a meat substitute made from wheat gluten, is actually at the top of the list. After that, as you can see, tempeh is up there when it comes to the number of grams of protein per half a cup. And all of these other sources, when you add them up, it's pretty easy to get the recommended amount that you would need on a plant-based diet. Now, protein guidelines for athletes. The recommended daily protein intake for athletes is at least 1.2 grams of protein per kilogram. So that's if you're training regularly in any way, for, say, you're an endurance athlete or a runner. But if you are resistance training, if you're a power athlete, you want to aim for much more than that. So twice the recommended amount for the average adult. So you want to aim for 1.6 grams of protein per kilogram to up to like 2 grams per kilogram. And that if you look at those sources, the tofu, tempeh, these are really huge sources of plant-based protein. And if you use an app, you can easily see how when you increase the proportion of the plant-based protein on your plate, and you just eat more calories, as many calories as needed to maintain your weight, you should have no problem reaching that target. And then just like many people do, you could always add a protein powder to supplement as needed. So when it comes to protein, people are actually more likely to suffer from protein excess than protein deficiency. We don't see protein deficiency in the US. It's really only seen in countries or places where people are not consuming enough calories, where people are not eating enough. And so the adverse effects associated with long-term high protein or high meat intake diets include calcium loss, kidney damage, increased cancer risk, fatty liver disease, and worsening of coronary artery disease. So moving on to carbohydrates. So not all carbs are created equal. When we think about carbohydrates or carbs, people think of breads and pastas and such. However, all whole plant food groups have carbohydrates. So what we want to be doing is focusing on whole or unrefined carbohydrates. Now, studies show that the lowest rates of diabetes in the world are actually found in populations where they eat more carbohydrates or a carbohydrate-rich diet. When it comes to diabetes, and if you have very severe diabetes or you're on insulin, then you may be counseled to eat lower on what's called the glycemic index, and that would be to avoid any spikes in insulin and blood sugar. But on the whole, if you have prediabetes or well-controlled diabetes, you don't really have to be concerned about eating fruits. And regardless, whole food plant-based foods are actually lower in glycemic index, and more processed foods are higher in glycemic index. So refined carbohydrates, these are our white breads, white pastas. any sugary foods, muffins, etc., anything containing sugars. And these are associated with overeating and obesity, insulin resistance, fatty liver, inflammation, and high triglycerides. So we want to substitute these bad carbs, the candies, the sodas, the pastries and such, with whole carbohydrates. So our starchy veggies, potatoes, sweet potatoes especially, beans, lentils, peas, chickpeas, whole grains like brown rice, quinoa, oats, and fruits and vegetables, and then pastas made from whole grains or lentils or other legumes. In the American diet, the major sources of added sugars are actually going to be from sweet beverages. After that, it's from sweets and snacks. Then you've got grains, some mixed dishes, dairy products, and so on. Fat is our next macronutrient. So we do need some amount of fat, but all foods, whole food plant-based, whole plant foods have some amount of fat. So when we're eating whole food plant-based, we're getting little bits of fat in the appropriate amounts. So we don't actually need to be adding more fat into the diet in the form of excess oils or other food products. And as I mentioned earlier, insulin resistance is fueled by saturated fat. And so this fat is mainly found in animal foods. But it is important to note, if you're eating a plant-based diet, there are certain foods that are high in saturated fat as well. So this would be coconut meat, coconut oil, and palm oils, any tropical oils. These are high in saturated fats, and these are not health promoting. We know that when it comes to fats, we want to stick with olive oil as much as possible. It has more of the unsaturated fats, and this is also found in nuts, seeds, olives, and avocados as our whole plant foods. In the American diet, the leading source of saturated fat is cheese. So this is just from the NIH, and it shows the main sources of saturated fat. So regular cheese, pizza, grain-based desserts, dairy desserts, chicken, and so on and so forth. Now this is a comparison of the different oils, and you'll see I mentioned olive oil has a high amount of the unsaturated fat that's good for us. And coconut oil has the worst. It has the lowest amount, and it is super high in saturated fat, even worse than lard. So all of these plant-based alternatives and such, these are not whole plant foods. And any of those that have coconut oil are going to be super high in saturated fat. And so it's going to drive up the cholesterol, worsen diabetes and chronic disease. When it comes to fat and heart disease, we actually see reversal of atherosclerosis or plaque buildup in the heart in people who follow a very low fat plant-based diet. That means about 10% of the total calories come from fat. And exclusively plant-based diets have zero cholesterol because it's only found in animal products. So a low fat, whole food plant-based diet is what's recommended when it comes to heart disease. So I mentioned we want to keep fat at about 10% of our calories, and you'll see on the right side these are whole plant foods. Although soy milk is processed, but you can see various different plant foods there, and you can see the percent of calories from fat in each of these. When you kind of average it out over the course of a day, if you're eating a varied whole food plant-based diet, you will probably stick to 10% of your calories coming from fat. And if you compare this to the left side there with egg, milk, cheese, and meats and fish, these are all very, very fatty, and they are going to, of course, promote heart disease. Next, when it comes to fiber, fiber is incredibly important. Most Americans, I think 97% or so, are fiber deficient. and it's only found in plant foods. Meeting the daily requirement of fiber is associated with 20-30% reduced risk of developing diabetes, and there is a stepwise reduction in diabetes risk with every couple grams of fiber consumed. So the more you eat, the better. When it comes to calcium, so many people, when we think about calcium, we think about dairy. And so many people believe that consuming dairy is the only way to get calcium, but it's actually a mineral found in the ground. And plants grown in the ground are excellent sources of calcium. We know that we lose calcium when we smoke, consume alcohol, have a high intake of animal protein and sodium, and if we do not exercise and don't get enough sun. And studies also show that in countries where dairy is rarely or never consumed, osteoporosis rates are actually the lowest in the world. So it actually doesn't do our bones good. Dairy does not do our bones good. So these are some plant-based calcium sources. We've got all of our greens, got tofu, soy milk, tempeh, kale, soybeans, bok choy. So if you're eating a varied whole food plant-based diet, you'll be hitting the daily requirements for calcium pretty easily. And then lastly, iron. There are two types of iron. There is heme iron that's found in animal foods and non-heme iron, which is found in plant-based foods. Now, heme iron is more easily and readily absorbed, but that might not actually be beneficial because our body does not have a mechanism for excreting excess iron. So it might actually be safer to consume plant-based iron. Now, as a family physician, it's easy for me to see when I do blood work, there really, whether you eat meat or not, iron deficiency, especially in women, is a huge, huge issue. And people eating a plant-based diet do not have higher rates of iron deficiency. And by the way, PSA to just make sure that ferritin levels are checked in if you haven't had it checked, if you're a female and you haven't had it checked, make sure you get it checked because you might just be flying under the radar with that when it comes to iron. And these are some great plant-based iron sources. So greens, beans, grains are really good when it comes to iron. And it's kind of when you compare it to hamburger or chicken, etc., there are plenty of good plant-based options of iron sources. So when it comes to a whole food plant-based diet, the way I generally counsel patients is I tell them I put foods into two categories, foods that promote health and then foods that promote disease. So in the category of foods that promote health, I say fruits, vegetables, whole grains, legumes, which are beans, chickpeas, and lentils, and nuts and seeds. And then foods that promote disease, the worst ones would be bacon and processed meats. Those are the class 1 carcinogens when it comes to colon cancer. And then red meats, and then chicken, turkey, fish, and eggs, and then dairy as well, especially cheese. So I just tell them every time you add a serving of whole plant foods, you're basically voting for your health. So every additional serving offers benefit. And then every time you reduce the number of servings of animal products or processed foods, ultra-processed foods, refined carbohydrates in the diet, every time you reduce one of those, you are, again, voting for health. So with each serving of vegetables and fruits, your risk of diabetes is reduced. So with every additional serving, it's 13% for green leafy vegetables, 10% for other vegetables, and 7% for fruits. When it comes to fruits and vegetables, we want to select unprocessed or minimally processed choices. So just fruits and vegetables as close to what they look like when they came out of the ground. When you minimally process them, so frozen or just plain fruits or veggies, that's fine too. And when it gets turned into juices or canned, that's where it gets a little bit more processed. And then highly processed would be fruit-based desserts or deep-fried vegetables. So legumes, as I mentioned, these are your beans, lentils, chickpeas, and peas. And the risk of developing diabetes decreases with higher legume intake. With these, again, you want to focus on unprocessed and minimally processed sources. So tofu, tempeh, bean pastas are fine, and then whole or dried or canned beans, chickpeas, or lentils. When they're more deep fried or these salty bean-based snacks like chips and crackers and such, they lose a lot of their nutrient quantity. Whole grains. So for every half an ounce of serving of whole grains, your diabetes risk actually is reduced by 11% for men and 7% for women. When you turn a whole grain into a refined grain, you lose the outer fiber-rich part, which is called the bran. And you also remove the inner germ part, which is the nutrient-packed core. So what you're left with is that starchy carbohydrate inside. When it comes to whole grains, again, you want to stick with unprocessed whole grains, such as whole or rolled oats, shredded grains would be fine, brown rice, quinoa. If you can see what it looked like when it came out of the ground, that's going to be best for you. As you process it more and turn them into flaked or puffed whole grains or other flour products, and super refined grains and snack foods and such, again, you lose all of that fiber and you lose a lot of nutrients. Nuts and seeds. So those eating 4 or more servings of nuts a week can decrease their diabetes by half compared to those eating less than 1 serving of nuts in a week. When it comes to nuts and seeds, I recommend going for a variety and also omega-3s. Omega-3s are very important for reducing inflammation and can help to elevate that good cholesterol, which can help get rid of the bad cholesterol in our body. So chia, flax seeds, hemp seeds, and walnuts are really great sources of omega-3s. And then when it comes to all these other nutrients, it's important to just get a variety of them throughout the day. Again, you want to select unprocessed or minimally processed sources of nuts and seeds. When we add oil or salt, or we have nuts and seed butters like peanut butters with added salt and sugar and oil, it becomes a lot more processed and a lot more calorie rich. And then even more so when we add any sweet coatings and such. So here are some plant-powered protein swaps, so some ways to increase plant-based protein in the diet. One option is to replace meat with lentils in soups, chilies, stews, and tacos. A lot of people like to eat scrambled eggs. Well, there's something called scrambled tofu. You can add in a bunch of spinach and peppers, mushrooms, and season it however you'd like to, and it tastes just as good, if not better. And then when it comes to grains, you want to choose quinoa over refined grains. It's going to have more protein, more fiber, etc. And then one super easy swap is to just swap your dairy milk with soy milk, which actually has the highest protein content out of all the non-dairy alternatives. And I didn't go into this, but soy milk has what's called phytoestrogen, and there is a myth that soy milk can increase estrogen levels and is associated with diseases that worsen with higher levels of estrogen, but that is actually not the case. It actually is associated with reduced risk of breast cancer and some other diseases. So it is actually protective. Soy products are protective. And then adding tempeh to some of your weekly meals. This is especially high in plant protein, so that's an easy way to make sure you're hitting your daily requirements, especially in athletes. So just a word about vegan junk foods. These are not whole food plant-based foods, right? They don't look like anything that came out of the ground, so best to just leave them off of the plate. These are associated with all of these chronic diseases that we have been discussing. And then meat and cheese alternatives. So when people think plant-based, a lot of people just jump to the Beyond Meats or Impossible Meats and such. Now these are not whole plant foods. These are not whole legumes or whole grains. These are ultra processed and they are extremely high in fat. And the reason for this is because in order to replicate the same mouthfeel of meat or cheese, you have to have the same amount of fat. And so that has to come from somewhere and it's added in. So these are not health promoting foods. I'm just going to touch a bit on obesity, because we know it is a huge risk factor for diabetes, heart disease, stroke, and some types of cancer. And people eating 100% plant-based actually have the lowest rates of obesity and overweight of all dietary patterns. This way of eating is actually naturally low in calories and high in nutrients. When it comes to weight loss, sufficient weight loss often reverses diabetes, and the more weight is lost, the greater the reversal. So even just losing 5 to 10% of your initial body weight can dramatically improve sensitivity to insulin and get rid of the fat that's in those cells. So this is a chart showing calorie density when it comes to the number of calories per pound in various food groups. Vegetables have the lowest. So if there's anyone who is trying to lose weight, I always tell them increase the proportion of the oil-free, non-starchy vegetables to the rest of the plate. And then snack on fruits and vegetables as much as possible. As we go higher up, we'll see that junk food has 2,300 calories per pound. And nuts and seeds are much higher in calorie density. Doesn't mean that they're bad for you, but just that if your goal is to lose weight, probably not a good idea to be eating them all day long. But it's a great source of protein, it's a great source of calories if you need to hit a certain target, especially when it comes to athletics. And we'll see oils have 4,000 calories per pound. So highest in calorie density. This is just another chart showing pretty much the same thing. And then this is showing that if you were to eat a bowl of olives, you're actually, it would take you 20 olives to get to the same number of calories as if you were consuming 1 tablespoon of olive oil. So that's a huge difference, right? If you're eating whole plant foods, they fill up your stomach and you'll be consuming far fewer calories along the way. If you're eating a diet high in cheese or meat or oils, it's gonna take you much longer to fill up your stomach while consuming fewer calories. So if you might be consuming a lot more calories by the time you actually get to the top of your stomach. So when you eat whole food plant-based, you can eat much, much more. So generally what I tell my patients is to eat, have a third of your plate be whole grains, a third of the plate be the legumes, and a third vegetables. This one shows 1/4 for fruits, but I just say snack on fruits throughout the day. And as far as the number of servings that you want to aim for, this is kind of the guideline that I use. So 3 to 4 servings of veggies, really the more the merrier when it comes to those. Fruits, 3 to 4 servings a day, focusing on a serving of berries, any type of berry every single day. Whole grains, 3 to 4 servings a day. And leafy greens, 1 to 2 servings a day. Honestly, the more the better when it comes to leafy greens as well. Legumes as well, 1 to 3 servings a day, and then fats and oils in the form of whole plant food should be 1 serving a day. There is an app called Dr. Greger's Daily Dozen app, and it has these food groups as a checklist, and there's a little info button, and when you hit that, it'll tell you what a rough serving size is. So when it comes to plant-based diets, there are a couple of vitamins you want to keep in mind. Actually, this is really important for everyone too, because it's actually not just seen in plant eaters, but vitamin B12 is a very common vitamin deficiency. B12 is made by bacteria found in soil, and animals get B12 from soil and supplementation in their feed. So it's really important to get those levels checked and take a supplement as needed. Vitamin D, regardless of diet, over 95% of everyone I check these levels on, people are very much deficient. So across the board, everyone really needs to be supplementing with vitamin D. Lastly, I just want to say that health comes from healthy living. It doesn't come from a medication, doesn't come in the form of a pill. And as athletic trainers, you guys know how important it is to stay active for your health, and nutrition is equally important when it comes to that. You know, when it comes to chronic disease and what I've seen in my practice, I have had patients come completely off of their blood pressure meds, cholesterol meds, and diabetes meds. I had a patient come entirely off of insulin and all oral diabetic meds over the course of just a few months when she removed the animal products from the diet and added the whole plant foods in. It is really, really remarkable what can happen when you shift even a little bit into this way of eating. So anywhere that that a patient can or somebody can improve their diet in terms of adding 1 serving of fruits or berries, a serving of whole grains, legumes, it's just really important. Every little bit counts, just as it does with exercise. I just want to go over a few resources here. Nutritionfacts.org is fantastic. There's a website, PCRM, that's the Physicians Committee for Responsible Medicine. There's also a journal, it's called the International Journal of Disease Reversal and Prevention, and they publish case studies and articles on disease reversal and prevention. The Plantrition Project is a great organization as well. They have a database of plant-based healthcare providers that you can search for. And then there's also the eCornell Plant-Based Nutrition Certificate if anyone is interested in gaining more knowledge. So this is nutritionfacts.org. There's a search bar at the top there, and you can type in anything from berries to arthritis to high blood pressure. And there are short evidence-based videos on all these various topics. And this is the eCornell Plant-Based Nutrition Certificate. And that is about it. This is my email address if anyone has any questions or would like to contact me. And that's about it. Excuse me.
All right, great. We have a few questions already. So the first question comes from Jessica, and she's asking about if someone is trying to utilize collagen, is there a best plant-based source for collagen?
I don't think I know the answer to that, but I don't think that there's any evidence that shows that supplementing with it has any benefit. But I don't have a particular collagen source, no.
She has another question within her comment, and that is about for gut and brain health as well as microbiome. What can you share about gut and brain health and the microbiome?
Absolutely. When it comes to the gut microbiome, the most important thing is fiber, which, as I mentioned, is only found in plant foods. And the key here is actually diversity of fiber. So as many different species of whole plant foods as you can get in within a day or a week, the better. That really just reflects diversity of your microbiome, of those bacteria and viruses that call your gut home. And when you have higher diversity, your body, your gut is able to handle more. So when you say you haven't eaten beans in a long time, well, you start to lose that population of bacteria that digest that particular bean. And so for each different food, there is a different bacteria that actually digests it, because actually those gut microbiomes are what's doing all the digestion. So when it comes to the gut microbiome, diversity is extremely important. And so, yeah, you want to get as many different species as you can. There is a huge connection between gut health and the microbiome, and mental health, and brain health. And so, really, I think there's a lot of studies coming out, but the more fiber that you consume, the better your brain health, and that axis between the gut and the brain. I also want to touch on omega-3 fatty acids. So when it comes to like mental health disorders, inflammation in the brain has been linked to some of these mood disorders. And so supplementing with omega-3 fatty acids, really getting them through the diet in terms of chia seeds, flax seeds, hemp seeds, walnuts, all of these will really help to boost omega-3 fatty acids, but most of us are just not getting enough when it comes to that. So that's really, really important. Yeah, one easy way to get a lot of those in is a green smoothie. So this is really touted by doctors who work with autoimmune disease. So there's this Dr. Brooke Goldner, who works with lupus patients and autoimmune patients. And one of the kind of hacks, or one of the easiest things that you can do when it comes to really getting in whole plant foods, is to drink a super green smoothie every day. So that means packing with whole plant foods, meaning 75% dark leafy greens, which is spinach or kale or arugula. Beet greens also fall into that category. And then 25% just, banana, frozen mango for sweetness, and a handful of some source of omega-3s. So chia seeds, flax seeds, hemp seeds, that would be a great way to reduce inflammation, help fight autoimmune disease, and feed that gut microbiome. Hope that answered the question.
And we have quite a few more, it looks like. So Giovanna is asking, what can you share about organic foods in the Dirty Dozen?
Yeah, so when it comes to choosing between organic or not, I always tell people to really, it's going to be depending on your budget, right? Depending on the patient or the individual's budget, it's going to be better for you to eat a non-organic food than not eat that food at all. But when it comes to organic foods, there's the Dirty Dozen and the Clean 15. And so the Dirty Dozen are the fruits that you mostly want to get organic as much as possible. I believe berries are on that list. So these are the foods where the pesticides really make it into the fruit, because there's not, say, a peel or some other barrier between the outside to the inside of the flesh of the fruit. So there's a Clean 15 where it's less likely to have the pesticides inside. So that's a little bit about that.
Nadine, and she said she read a book called Diet for a Small Planet, and that discussed combining foods to get the full complement of amino acids. Can you discuss this?
Sure. Yeah. So I think I touched on it a little bit. When it comes to plant-based diets, there's this kind of myth that you're not going to get all of the essential amino acids, which are these amino acids that the body cannot produce, so we need it from our food. Um, and so meat and some of these other sources, they have all of them all in one, but that doesn't mean that they're actually superior to plant-based sources, because as long as you're getting all of them over the course of a day, you're getting the variety that you need when it comes to those plant proteins. So as long as you're eating a varied diet, remember there's protein in all of those whole plant food groups, whole grains, even fruits, vegetables, and legumes. So you're getting a little bit from everything, and if you focus on variety as much as possible, you're going to be easily getting all of the amino acids and all the protein that you need.
Okay, the next question comes from William, and he says, do you find the GI upset, bloating, and gas with changes from a SAD to whole food plant-based diet?
Absolutely. And so the reason for this gas and bloating is that the gut is not equipped essentially to handle the types of fiber that are being newly consumed. So what that means is, as I was mentioning earlier, if you haven't consumed, say, a chickpea in 5 years or something like that, the bacteria that can handle that chickpea and break it down and digest it simply is not there. So it's actually going to it's going to cause a lot of gas and discomfort in the abdomen. So the key to that, the solution to that, is to very slowly taper up these foods. If you go overnight, you're gonna be in a lot of discomfort. And so there is a threshold at which that particular food that causes bloating will not cause bloating, right? So maybe it's one single bean, maybe there's bloating at a tablespoon. So you want to start very low and slowly increase it. And over time, it might take just a couple of weeks for that microbiome to get used to that new food. But you want to slowly taper it up so that the population of those bacteria that digest those food increases and grows incrementally. So yeah, I think that answers that question.
All right, the next question comes from Alan, and Alan asks if you have any recommendations for someone with celiac disease who has low ferritin, non-anemia, so iron deficiency without anemia, and he appreciates that you had mentioned checking ferritin, and that is his question.
Yeah, so some people for various reasons do not absorb oral iron. There are several different causes for that. For some people, maybe they've had a surgery that reduces the surface area of their stomach that's there, and they may be taking a medication that can lead to vitamin deficiency or iron deficiency. And for other people, it's something else. So generally, I would recommend evaluation with a hematologist to see if iron transfusions are necessary. Really, a thorough evaluation with a specialist in that case. But I will say, when it comes to iron, and so in celiac, there are still, gluten-free sources. Most of that, when it comes to greens and beans and such, those are really good sources. But I do find that across the board, a lot of women especially will struggle with iron deficiency, and it's really hard to get the ferritin level up to where it needs to be without a supplement many times. So I just recommend working with a physician to get it to the level that is appropriate.
And the next question comes from William, and he asks, do you find that probiotics are necessary with a whole food plant-based diet if a person is taking them prior to changing diets? Oh, and so those kind of a follow-up to his previous question about the GI upset.
Okay. Yeah, so from what I know, the research really shows that probiotics don't really help with a lot. We used to think that, you know, if you take them while taking antibiotics, that it would maybe help. There's not really a ton of evidence to show that probiotics really help. Ultimately, probiotics are your gut bacteria. I would say, you know, when it comes to any kind of supplement, whether it's probiotics or not, if there's no risk of harm, and if the cost is okay, I would say you can go ahead and try it. I'm not sure if like before actually transitioning or during the transition, if that would really help with any of that gas or bloating, but I'm not sure the evidence is there to support that.
Nadine has a comment about, she read the book, I Contain Multitudes to Learn about gut health and microbiome in humans and animals. And it's amazing. She's listening to the book on tape.
It's awesome. There's a
many.
Oh, sorry, go ahead.
There are lots of people on here that are asking, that are saying thank you for your talk tonight.
Yeah, just to add to that, Fiber Fueled by Dr. Will Bolshevitz is a great book. He's a gastroenterologist, and it just really, again, talks about the importance of diversity of different whole plant foods. Even if you're not consuming a plant-based diet, like an exclusively plant-based diet, it's really important to diversify those plant foods as much as possible for your gut.
Thank you so much for your time tonight, Dr. Cherian. This was a fabulous talk. It was right around 90 attendees, so had a lot of people here very interested in what you had to say. So yes, thank you very much. And any last comments from you?
No, yeah, I think this is just so important that I make sure to discuss diet with every single one of my patients and anyone in my life, really. And so any little bit can go a long way. Nobody has to go completely vegan in order to see these benefits. They're seen even with just, say, someone's eating meat 3 times a day or dairy 3 times a day. If you reduce it to just once a day, I've had patients come completely off of medications even just by that. It just depends on how sick they are, and it just takes a longer time. But it is truly powerful. So I hope you guys take something out of this. Oh, thank you so much.
Awesome, and thank you everyone for attending. I hope everyone has a great night.
Take care.